Dr. Hyams, who's head of the IBD program at Connecticut Children's Medical Center. What is IBD?
Inflammation. Okay, so inflammation means redness, swelling, and the term IBD stands for inflammatory bowel disease. So what that means is that inside the gastrointestinal system, the inside lining has become red, it's become swollen, and that leads to the symptoms that we see. This is what the gastrointestinal system looks like. And in inflammatory bowel disease, or IBD, there can be inflammation any place in the gastrointestinal system. In something called ulcerative colitis, the inflammation is limited to the large intestine. In another disorder, which is very similar, called Crohn's disease, the inflammation can be in the large intestine, small intestine, and even in the upper part, the stomach or the esophagus.
So why does IBD happen?
Well, I wish we knew the answer to that. And I can tell you there are a lot of people who are working very, very hard to figure that out. So what I can share with you today is really what our most current understanding of this is. Inside our gastrointestinal system, particularly inside our large intestine, are literally trillions of bacteria. And those bacteria actually are very important to us. They help us digest our food, they make vitamins, and we live in peaceful coexistence with our bacteria. Something happens in individuals who get IBD whereby all of a sudden the intestinal immune system thinks that the bacteria are doing mischief. So it doesn't want that to happen, and it tries to mount an attack against the bacteria. Unfortunately, the normal lining cells are like an innocent bystander, and they become damaged, and when they become damaged, the intestine becomes red and swollen and doesn't work, and that's why people get IBD. That's what we think today, and we're getting closer and closer to really figuring that out with each passing year.
So a big question is there anything I did wrong?
So the answer is there is absolutely nothing that you did wrong or anything that your parents did wrong or anybody else.
And will it ever go away?
So as of today, we don't have a cure. Cure means we fix it, you never have to worry about it again. So we don't have that today. Having said that, the medications that we use and the things that we do are extremely successful in the overwhelming number of patients who we see, such that for most people, their symptoms go away, they grow normally, they lead a normal life. So we manage this today, we don't cure this today.
How is it treated?
So there are many ways. And again, most of our treatments are to reduce inflammation. So sometimes we know that diet can play a role. There are some very specialized diets where, as crazy as it sounds, we have people not eat regular food for a month or two and just have these special liquid diets, and that works for some people, not for all. We know that for other people, just changing things around may help, although it's usually not enough. So for most people, we wind up having to use medicines. And the medicines range from sort of little medicines, which work, you take them by mouth and they work topically, so in other words, on the surface, to other medicines that people take where they go and they circulate into your whole system. Having said that, for each patient, we try to customize the medicine to the severity of the inflammation, how old they are, where they are, what they want to do. And it's really a joint decision between our patient, their family, and us on how we move forward.
So if diet plays a role in IBD, like what's some things that maybe not good to eat or good to eat?
So we do know that there are certain things that tend to promote inflammation. So diets very high in fat are probably not good. Diets that have a lot of artificial ingredients, things that are processed, that allow things to stay on the shelf for 2 years, may not be good for your intestine along the way. So junk food, probably not good. That doesn't mean never junk food, but it means being careful about what you eat. And certainly if you eat something and you don't feel well afterwards, your body is telling you probably not a good idea to do that again.
Yeah. And one last big question is, will it prevent me from being normal?
So the answer is no. All right, so I've been doing this a long time. I've probably taken care of a couple of thousand kids with IBD. And what I've noted is, number one, as a group, how strong they are. This is an incredibly resilient, bounce back kind of group of kids who sort of overcome whatever obstacles they need to overcome. So yes, there may be periods where people don't feel well, but in general, it's not very many people where that occurs. And for that particularly small subgroup, there are other things that we can do as well. But I've never seen anybody not grow up, not play the sports they want to play, not do interacting with their friends along the way. So I was hopeful when I started this journey 30 years ago. I'm extremely hopeful right now that things are going to change, and only for the better.
Great. Well, thank you so much for answering all my questions.
Great. It was my pleasure.
Thank you.